Supervision. All of your supervisors have to undergo training and are registered on a GMC database. There are two main types of supervisors you'll have. The Educational Supervisor, or ES, has a responsibility to oversee your training for a long period of time, generally at least a year. Your Clinical Supervisor, or CS, is there to only oversee your training within a specific post. In a lot of hospitals, your supervising consultant for the first rotation of the year is both your Educational Supervisor for the year and your Clinical Supervisor for that post. Your supervisors are there for advice, as well as to help with your training. The Educational Supervisor will have knowledge of your training programme, and both your ES and CS will have knowledge of the local system, and even if they can't answer questions, they're generally able to point you in the right direction, especially when it comes to what's the best way to get something done in a specific place or hospital. It's expected that you'll meet with your supervisors regularly. As a minimum, you should meet with your ES formally and record it on the e-portfolio at least 3 times a year. You have to meet with your CS at least twice per post, at the start and end, but we'd recommend a midpoint meeting as well. On top of these formal meetings, you could easily meet more informally to address simpler issues, and you could reflect upon these, or if they feel they need to, then the supervisor can put an entry on your portfolio. There's a template to fill in on the e-portfolio for your supervision meetings. You're able to complete and save as a draft the induction appraisal form, as well as midpoint and other educational meetings, and we'd encourage you to do so. These can be found under the appraisal tab of the e-portfolio, and your supervisor can then load your draft version prior to finalising it. The induction meeting is incredibly important and outlines exactly what you and your supervisor have agreed you're going to do in the rotation. We've written an initial supervision meeting checklist that we'd encourage you to go through with your supervisor when you meet to ensure you're covering everything. If you're having problems with achieving a required element of the curriculum, such as clinic attendance or specific procedural skills, you should record your meetings to discuss this with your supervisor, using either the midpoint or more general educational meeting forms under the appraisal tab. Here you can outline both the issues faced, but also an agreed plan on addressing it.